Hi, I'm Dr. Mike DiTola, and welcome to What Lies Beneath, a show that looks at what drives some of today's most passionate clinicians to create beautiful chairside restorations. Our show partner is Kuraray Noritake Dental, a company whose world-class adhesive and restorative products allow dentists to provide their patients world-class restorations. In this episode, we will be taking a closer look at the Katana Zirconia Block and its use in creating beautiful chairside restorations. Today's featured clinician is Dr. Dan Butterman. Dan has a private practice in Centennial, Colorado, and is also a faculty member at CDOCS. Dan, thank you for taking some time to speak with us today.
Oh, thank you. I appreciate being here.
So you've been nice enough to share a couple cases with us today, and I want to get right into them because there's a great straight up kind of crown and bridge case and then an implant case. But you also want to talk about the difference between polishing and glazing zirconia, and this has certainly been a hot topic. And I like that you're going to start off with a little bit of research here rather than opinion. So why don't you tell me about this piece of research?
Yeah, I think Nate Lawson did a fabulous job with this study where he talked about the looking at zirconia in a polished state versus a glazed state. And I think one of the things that we all want to do for our patients is make sure that the restoration that we give them is going to work well, but not cause other issues. So just pulling from that study, what he found is that if we have a polished restoration, it's just going to be kinder to the antagonist versus a glazed restoration. So one of the things that I like to focus on in my practice is going through some sort of a pre-polishing step, because the way I see it, and really for ease of use for my assistants, if you need to get it smooth, what's the best time to do it? Do it when it's already centered and incredibly hard, or do it in the green state when it's quite easy to work with. So the way we typically do it in my practice and the way I like to teach is that we're going to pre-polish it. So just walking through some steps. First slide is just going to show that really we don't want to take this crown and break it off of the block when it's manufactured. We want to actually cut it off of the block so that we're not inducing any fractures. And then we're going to move to using some sort of a medium polisher. These are just Meisinger spiral polishers that we use for ceramic. And this is just going to be used to take off any of the burr marks. So from here, we're going to bring it to our polishing step. The polishing step is actually going to start to get things smooth as opposed to just removing burr marks. I don't want to use this on my contacts. Certainly, this is still too aggressive. We don't want to open up our contacts. We just want to get a nice smooth surface all the way throughout. And then finally, I take it to my ultra high shine polish. And if you were to see this in person versus just a photo, you'd actually see a pretty heavy shine to the restoration. If we bring it to this point before we even center it, it's shiny. The way I consider shiny is just a side effect of what we ultimately want, and that's smooth. So we have a very, very smooth surface before we even put it into the oven to center. And you can see as it comes out of the oven, the only thing that I have to do at this point is just give it that last little bit of high shine. I just use that same step that I used in my green state, and we can bring it to a point that really looks glazed. So we're going to have a surface, we're going to have a texture that's going to be very kind to the antagonist, and it's going to appear glazed without the risk of causing damage with the glazed surface.
And yeah, it's great you mentioned that, because so many times one of the reasons why we're choosing, for example, Katana Zirconia in a restorative case is because the patient has done a lot of damage to their teeth or to their opposing teeth, or they've got this strong masticatory system. And so we know that they've got the potential to cause wear on those opposing teeth. So it's really great that you put so much thought into polishing it, because glazing, it's faster, it's easier, but it's not in the patient's or the tooth's best interest. So it's great that you guys are spending so much time thinking of ways to make sure that the restoration we create is not going to cause any iatrogenic damage to the opposing tooth. You've got a cool crown and bridge case here that I'd like you to walk me through and tell me what you're doing here.
Yeah. So now that I've said that I like to polish my zirconia only, I'll show you a glaze case. because quite honestly, sometimes for aesthetics, we absolutely do need to do some, and I'll just kind of walk through that a little bit. This was a gentleman that was he just turned 60 actually, and his wife was tired of looking at him the way he looked, and his requirement for me is that he wanted to look more youthful. I don't
Okay.
think 60 is that old, but apparently that's the age where we need to start thinking about that kind of stuff. So he had a fixed bridge on 9 to 11 that was failing. And if we kind of look, one of the first things that I do is I just want to know if we're going to be able to achieve symmetry. So I like to measure the size of the crowns. And if we hit the next slide, we'll just kind of see a measurement on that.
Mm-hmm.
So I know that my width to height ratio of those two front teeth, even though they don't look anything alike, my width to length are fairly symmetrical. So I know that I'm going to be able to achieve a result. I also know that they're too short. Width to length ratio, I'd rather it be, say, 70 to 80% or so.
Right.
And that's kind of the money shot that I like to do with my patients when we're looking at aesthetic cases. That's why it looks old. That's what gives you that lip at rest, how much tooth is going to show. And that's kind of what gives us that sort of an aged appearance. So this is a case, and in the next slide, we kind of, the workflow that I typically do on these cases is that we're going to be able to prep our teeth. And you just see the gross prep. But what I want you to understand from this is that with any of my cosmetic cases, I like to do a diagnostic wax up. So we understand where we're going with the end in mind. And with the CEREC software, I'm able to actually stitch a hybrid model of the diagnostic wax up with the patient's prep teeth, and we can end up being able to just duplicate or copy in our design. Basically, we're using a biocopy mode to do that. So previously, I probably would have used a glass ceramics for that bridge, but somebody like this, and you kind of see the parafunction, the kind of wear that he has on his teeth, I just don't feel like that's strong enough, even though potentially it's indicated for it. So I needed something a little bit stronger. And for me, zirconia, until recently, that was a posterior material. Katana crowns that were going on posterior teeth works great. They look good. The idea of using them for anterior restorations was kind of a little bit outside of my comfort zone. But this was sort of that first case that made me take that leap. So to the next slide, we can kind of see that this was his starting point and this was his ending point. Now,
Nice.
if I'm doing anterior restorations, my goal is typically going to be able to improve the aesthetics of it. And there's going to be a little bit of standing glaze. I don't feel like just a polish alone on the facial surface is going to be enough. Now, the functional lingual surface, that's going to be heavily polished. Here, we're just talking about more of a stain and glaze in cosmetic areas, and functional areas are going to be polished.
Yeah, and I don't think that anybody's worried about. There's nothing bad about glazing zirconia if it's not opposing a tooth. There's no reason not to. The only thing we need is that lingual surface against those lower anterior teeth. So that's a really common sense approach of not just like memorizing a rule and being able to kind of do it on the fly and understand why you want to have it polished in one place and glazed in another.
Right. Yep. And again, just back to that shot. This is where I look when I see that I've created what I want to create as far as a more youthful appearance. And that lip at rest here, we've got about 4 millimeters showing of the anterior teeth, and really that's what he was looking for. So I've kind of started using Katana more in my anterior cases, and if we can just kind of, here was my typical workflow in the next slide. And then what I used to typically do is I would design my bridge. For those of you that have designed restorations or anterior restorations in the CEREC software, you go through a lot of trouble using tools and sizal variation, trying to make it look absolutely perfect. You've got this beautiful restoration. Unfortunately, when you mill it out of glass ceramics, that's not what you get. You have something that's very, very unfinished just because of the size of the tools that are used to create and to grind on glass ceramics are relatively large. So if we move simply to zirconia and we mill something out of zirconia, the cool thing about it is because we're using much smaller diameter tools, Katana is going to shrink almost 25% in the oven when you sinter it. So all that anatomy, everything that you put into your design, you're actually going to be able to manufacture, which makes the post-mill process. I just don't have a lot of work to do with my restoration as it comes out. So as we advance here and just kind of look at the raw milled restoration, there's just not much to do. All I did with this restoration was pre-polish it with the steps that I showed you before, and it's ready to go in the oven and sinter it. Now, my opinion. Oh, go ahead.
Well, I was just going to say that was one of the way back in the day when I first saw zirconia being milled. I was just amazed because it did start off as a posterior material. And when I was watching it being milled in the lab, the first thing that I noticed was we could see occlusal anatomy on these crowns that we had never been able
Yeah.
to see when hand stacking, ceramic, or even to your point, milling glass ceramics. And all of a sudden it felt like a ship in a bottle where, because it was larger and because we had smaller tools, there was all this anatomy where you looked at it and you go, oh, that's what a crown's supposed to really look like and have that anatomy. And to your point, that's valid on anterior teeth just as much as it is on posterior teeth.
Right. I think that's been a big leap forward, and I think that's why a lot of us have really started to enjoy using zirconia in our practices, because finally we can start to get these lab quality restorations with the anatomy that we always hoped we would. And for me, if I am going to do a stain and glaze, I just feel like using the same manufacturer's products is probably a good idea. This is just CZR stain and glaze paste that I'm putting on Katana, and I just think that's a good idea to match and use same company products, and it works well. It's a paint on glaze. This of course is done after you sinter it. You do a separate firing cycle with it. Paint on glaze, and the actual stains or colors actually have glaze mixed into it as well. So you just really have a nice surface on to apply to the facial here.
And you have an implant case that you like to share too?
Yeah, let's talk about implants, because I think that has been sort of a big push. Number one, being able to restore them in office has been huge. Using CEREC, using digital imaging, using that sort of technology has been incredibly helpful. So the Atlantis workflow, for some of you that aren't familiar with it, the premise behind this is that we're going to do an optical scan with a scan body. We're going to use their Atlantis IOFlow scan body. We'll be submitting that case to Atlantis. They're going to design the actual custom abutment out of titanium, but where we get to play is they'll send us a file, and we'll be able to actually make the crown in office. So when I submit it to Atlantis, a few minutes later, I'm going to get a design that I can approve. So here they're just showing us what the abutment is going to look like. We can see it from multiple directions as we make our way through it. And then once I approve that file, once I submit, yes, that's what I want, then they're going to send me a core file. So that core file is basically a virtual model with the abutment already attached to it. So the cool thing is the abutment hasn't actually been fabricated yet. So a normal analog workflow is I order an abutment or I have a lab make it for me. I have to have my patient back, put it in their mouth, and do some sort of an impression with their abutment in their mouth. With this workflow, I can just take the virtual abutment that hasn't even been made yet, attach it virtually to the model, and now I can design my crown before I even have it. So I don't actually have to place this in the patient's mouth. So crown can be designed. And if we go to the next slide, one of the things that surprised me a little bit, and I know a lot of people are using this kind of Atlantis type workflow, which is great. A lot of times the abutments have some relatively sharp anatomy. And as we've already mentioned with glass ceramic, sometimes those tools are just so large that the fit of the restoration, the glass ceramic to the abutment, isn't ideal. We can see the far right margin fit with a Katana restoration is just so much more accurate. The margins fit better here. And just in playing around with a number of restorations, just trying them with glass ceramics versus Katana Zirconia, there's just so much less overmilling because the tools are smaller. It's not rocket science. You use a smaller diameter tool, you're going to be able to capture all of that anatomy, and then you have a restoration that's going to shrink, and the fit's just going to be fabulous. And just case after case, we can just see that our restorations that we make in our office are going to have perfectly fitting margins to these Atlantis abutments. Before the abutment has even been created, this is just off of a virtual core file. So our workflow becomes quite simple with these restorations. We're just going to have the abutment that's going to come back. And if we move to the next slide, this is the abutment that Atlantis makes, and then you can design just as you would pretend it's a tooth, design your crown. This is out of Katana, and we can be pretty comfortable that that fit is going to be dead on. There's just not going to be any issues with that. And really, we can kind of see the transitional colors, the multiple colors going through the Katana block. So on something like this, I wouldn't stain and glaze. I just don't feel like there's a need for it, and it'll give us a great result. And then just one last case. This was a surgical procedure for an implant, Astra EV implant that was placed. Custom healing abutment goes on. Similar workflow. Patient's going to heal. I'm a huge fan of custom healing abutments, obviously beyond our topics for today. But premise is the same. I'm going to send this case to Atlantis with a scan, and they're going to send me a core file, and I'm going to be able to design my crown on there. And the cool thing with this stuff, completely different workflows, but there are times where I'll take my scans at the time of implant surgery. If I'm not expecting teeth to drift, or I'm not expecting much in the way of tissue changes, you have the luxury of being able to do your scans initially at time of surgery. So when this patient came back in the last slide here, we can kind of see that is going to be his restoration. That's going to be delivered. And the cool thing with all these cool digital workflows that we have is that quite often our patients, when a patient comes back for their imaging appointment and their second appointment, as we'd normally do it, they're always disappointed, because no matter what you tell them on the phone, no matter what you say in advance, they think they're getting their crown.
Right.
And it's always disappointing. No, we're just doing impressions, we're just doing imaging. But with these great new digital workflows that are out there, with these crown materials that we can manufacture in advance before the patients even come in, and we know the fit's going to be ideal and perfect. We know the cosmetics are going to be there with a Katana crown. Their second appointment, I can often deliver the restoration. So nobody's disappointed. I'm super happy because I save an appointment. Patients happy, they get what they wanted.
Well, Dan, I love your approach to whether you're going to polish or whether you're going to glaze the Katana Zirconia. I'm interested to hear, when you're utilizing Katana Zirconia, how do you kind of make a decision whether or not you're going to cement it into place or bond it into place? Because obviously we grew up in a time where we were bonding almost all glass ceramics into place, and now we have the opportunity, because of the strength of the Katana Zirconia, to be able to cement it into place. I'm just wondering how you make that kind of decision based on an individual case.
Yeah, so it's become less of an issue for me. Previously, I mean, let's face it, one of the reasons why a lot of us moved into zirconia is because you can cement it, and bonding is great and it's fine. And then if somebody tells you don't have to do it, you're like, oh my God, I hate bonding. I never want to do it again. So I mean, I kind of get why we want to do that. With a bondable zirconia like we have with Katana, and quite simply, the cement that I'm typically going to use to bond this into place is almost as easy as a conventional cement. Right. Typically, I'm going to use Panavia SA Universal Cement, and that's going to be something that it's going to be, my workflow is going to be quite similar to conventionally cementing it. The cleanup is going to be quite similar. But because we're going to aerobrate our zirconia, because the cement has MDP in it, that's going to give a bondable surface to the zirconia, you kind of have the best of both worlds. So so the long answer to your question is, I'm pretty much just bonding it now, because it's really just about as easy as conventionally cementing it used to be, and there's not really a reason to compromise anymore.
Exactly. And I think when people do react, or dentists do react and say they don't like bonding, it was more along the lines of a total etch technique, and not necessarily the simplicity of using a material like Panavia. Yeah. Well, good. Thank you for settling that dispute or that controversy as well. It's always nice to get your 2 cents on things. Dan, thanks again for spending a couple minutes with us today. Really appreciate you sharing those cases with us.
My pleasure, Mike. Thanks for having me on here. I truly enjoyed it.
Well, that will wrap it up for this episode of What Lies Beneath. So on behalf of myself, Kuraray Noritake Dental, and Practice Passion, I want to thank you for your time and your continued commitment to quality dentistry.